afternoon, everyone. My name is Ruth, and I'm going to be doing a Microteach session with you this afternoon. So I am one of the clinical educators at First Option. So before we start, I'm just going to tell you, so we don't have a fire drill plan today. So if the fire alarm does go off, we will need to evacuate. And the fire exits are just out through that door and down the stairs through the door directly opposite. The toilets are out by the lifts when we came up today to get to the room. So if you do need to leave the room at any time, please feel free to. Okay, so before we start, can I just ask you your names, please?
Amanda Stevens.
Thank you.
Sam Hughes.
Karen Fitzpatrick.
Thank you so much. So today we're just going to talk about endocrine disorders. Okay, so before we start, I'm just going to go through the aims and objectives for today. So you will see in front of you, you've got some handbooks as well. So they basically just have the slides that we're going to be talking about this afternoon. Okay, so the main aims for today's session is that by the end of it, you will have an understanding of the endocrine system. You will understand categories of endocrine disorders. You will understand some of the causes and symptoms of common endocrine disorders. We will go through some common endocrine disorders, and we'll talk about diagnosis and treatments as well. Okay. So the main learning outcomes are that you will walk away with a basic knowledge of the endocrine system and common endocrine disorders, how they present and how they are treated. Okay. So we'll just make a start with what is the endocrine system. Okay. So the endocrine system is a collection of glands and organs that regulate bodily processes using hormones. Okay, so hormones, these are the chemical messengers that travel through the bloodstream and influence all of your bodily processes. So the primary parts of the endocrine system include the hypothalamus, the pineal body, the pituitary gland, the thyroid and the parathyroid, the thymus, the adrenal gland, pancreas, ovaries and testicles. There are other parts of the endocrine system that regulate a range of processes, and these include your metabolism, reproduction and growth. Okay, so just to follow on from what I've just told you, we have a little diagram here that tells you where in the body those glands are. So you can see that each gland is in a different part of the body, starting from the brain, going all the way down to the reproductive system as well. And each of those glands is responsible for a different part of the body as well. Okay, so we'll start with the glands. Okay, so each gland in the endocrine system releases specific hormones into the bloodstream, and those hormones need to travel through the bloodstream to where in the body they are needed. Okay, so they help to control and coordinate many body processes. Okay, the endocrine glands include the adrenal glands, so these two sit at the top of the kidneys, and they release the hormone cortisol. Okay, the hypothalamus, a part of the lower middle brain, tells the pituitary gland when to release hormones. So the pituitary gland is the hormone the gland that produces the hormones that deals mainly with growth. Okay, so if you have a pituitary dysfunction, you are likely to have some kind of growth dysfunction as well. The ovaries, so these are the parts of the female reproductive system, and these are also classed as glands of the endocrine system, and they are the ones that release the eggs and produce the sex hormones in biological females. The islet cells in the pancreas, and these are the cells that control the release of the hormones insulin and glucagon, and these are the ones that come into play when you have patients who have diabetes. Okay? And then the parathyroid comprises of 4 tiny glands in the neck, and they play a role in bone development. Okay? So the glands, so just continuing on, the pineal gland is found near the center of the brain, and this is the gland that controls your sleep patterns. So when you are settling down to go to sleep, there are hormones that are released into your system to help your whole body relax when you're at rest. A gland found at the base of the brain, which is the pituitary gland. This is often called the master gland, because this gland influences many of the other glands of the endocrine system. Problems with the pituitary gland can affect many things, so bone growth, menstrual cycles, release of breast milk. There are some problems that it can cause in males as well, and to do with infertility as well, if there is a problem with the pituitary gland. The testes, which is the male reproductive gland, they produce the sperm and the sex hormones in biological males. Okay? The thymus is a gland in the upper chest that helps to develop the body's immune system, and this usually starts very early on in life, starts in utero, so that's when the mother is still pregnant with the baby. And then the thyroid is a butterfly-shaped gland in the front of the neck that controls the body's metabolism. Okay. So now that you have an idea of what the glands of the endocrine system are and what the endocrine system is, I'm going to talk about endocrine disorders. Okay, so endocrine disorders are disorders that affect the entire endocrine system. The system uses glands throughout the body, as I've already explained, and if these hormone levels are too high or too low or not present, a person may have or may be thought of to have an endocrine disorder. So endocrine disorders are a range of medical conditions which usually with the hormone production, they do not function properly. Okay. Endocrine disorders have several potential causes. Some of the causes can be genetic, they can be just hormonal imbalances, tumours as well, so tumours that are non-malignant or malignant can also cause endocrine disorders, and there are a wide range of symptoms that influence growth, development, metabolism, sexual function and mood.
Quick question.
You can.
Just out of curiosity, because some of these are situated in the brain, if there's an issue there, would they have like a learning disability, or could that be something completely impartial? That would be the syndrome? Or...
So it depends on what part of the brain it affects. So there are some areas where it may well cause a learning disability, and it might also not cause any kind of learning disability. There are many people that have an endocrine disorder that starts in the brain, but they actually live undiagnosed for a very long time, and then when they are finally diagnosed, it kind of makes sense, and they realise that they've had the symptoms of the disorder for quite a long time.
Quite progressive.
Okay. So there are categories of endocrine disorders. So they are typically two categories. So an endocrine disease that results when the gland produces too much or too little endocrine hormone, which is called a hormone imbalance. And then endocrine disease due to development of lesions. So lesions are also known as nodules or tumours, depending on the size of them. So usually if they're nodules, they're quite small. If they're tumours, they can start quite small and grow quite big. Okay? And these may not affect hormone levels at all, but they may affect just the individual. They may affect other parts of the body as well. So there are many causes of endocrine disorders. So the endocrine's feedback system helps to control the balance of hormones within the bloodstream. If the body has too much or too little of a certain hormone, the feedback system signals the proper gland or glands, depending on what the problem is, to correct the problem. So a hormone imbalance will occur if this feedback system has trouble keeping the right level of hormones in the bloodstream. Okay. If the body doesn't clear them out of the bloodstream properly, increased or decreased levels of endocrine hormone may be caused by a problem with the endocrine feedback system, a disease which may have a secondary effect on the endocrine system, a failure of a gland to stimulate another gland to release hormones that are needed. So for example, if there's a problem in the hypothalamus, it can disrupt hormone production in the pituitary gland. A genetic disorder such as multiple endocrine neoplasia, which I'm going to go into a little bit later on, and also congenital hypothyroidism. Infection can also be a cause. An injury to the endocrine gland, so it could be a traumatic injury, or it could be an injury that may have been caused by disease, or it could be an injury that may have been caused by surgery. and then a tumour of any endocrine gland as well. So most endocrine tumours and nodules are non-cancerous, but they can actually have the same effect as a cancerous tumour. Okay. They usually don't spread to other parts of the body, but a tumour may interfere with the gland's hormone production. Okay. Right, so we're going to talk about common endocrine disorders. Now there are over 100 endocrine disorders, but the ones that we're going to look at today are the ones that are most common. Okay. So I think one of the most common ones is diabetes. Okay. I'm sure everybody's heard of diabetes. So diabetes is a condition that causes high blood glucose levels due to the body being unable to either produce or use insulin sufficiently to regulate glucose. So two of the most common types of diabetes are type 1 diabetes and type 2 diabetes. You also have gestational diabetes and you also have diabetes insipidus. So there are many types of diabetes. Usually because everyone who isn't affected by diabetes knows what diabetes is, but it's always assumed that it's just a problem with regulating sugar. And very few people associate hormones with diabetes. Okay. So diabetes symptoms can include increased thirst and urination, increased hunger, unexpected weight changes, so that could be weight loss or weight gain. Persistent sores, so this is usually affected in the extremities and it's usually in the feet. Numbness and tinglings in the hand or feet, tiredness and blurry vision. There are different treatments depending on the type of diabetes that a person is diagnosed with, but people with diabetes usually require regular insulin. Sometimes in type 2 diabetes, it's just tablets and diet that can be used to regulate, but occasionally with some types of type 2 diabetes, you can have tablets, diet, and insulin as well. Type 1 diabetes, anyone with type 1 diabetes will always need insulin. Another common one is hyperthyroidism, so hyper meaning high. Okay, so this occurs when the thyroid gland produces too many hormones. And this condition has several causes, possible causes I should say, including inflammation of the thyroid gland, which is sometimes called Graves' disease. Thyroid hormones help to regulate energy throughout the body, energy use throughout the body, and this means that the condition can cause a wide range of symptoms, which can include a rapid or irregular heartbeat, difficulty in sleeping because your body is continuously hyper, irritability and nervousness, tiredness because if you're unable to sleep, you're tired, poor temperature regulation, frequent bowel movements, weight loss with an increased appetite, and a goiter, which is a growth on the neck, which is just illustrated there. And treatments for hyperthyroidism will depend on its cause, on the symptoms, so a person may have one or all of those symptoms, and the person's overall health as well. So they could include medication, radioiodine therapy, or thyroid surgery. And then we go the opposite way, and this is hypothyroidism. And this occurs when the thyroid does not produce enough hormones, and in some cases, no hormones at all. The most common, it is the most common thyroid disorder, and it can cause bodily processes to slow down. So the symptoms will include tiredness, sensitivity to cold, slow speech, droopy eyelids and facial swelling, dry skin, a slow heartbeat or muscle cramps, confusion, constipation and weight gain, tingling in the hands. So with hypothyroidism, statistically this is the one that a lot of people live with for a long time undiagnosed. Because I'm sure you recognise some of those symptoms already. Some of these are things that people suffer with all the time. And they don't necessarily associate this with a thyroid problem until it actually becomes quite a big issue in their lives. So it may well be that there are millions of people walking around with undiagnosed hypothyroidism unless you actually go to a GP and give your symptoms, and the GP is able to do these tests to determine it, you may not actually know that you have it. So a lot of people are diagnosed with this quite late. And then you have Cushing's syndrome, which is another quite common endocrine disorder. So this occurs when there is an excess of the hormone cortisol. So cortisol is a steroid hormone, and it is produced by the adrenal glands, which sits on the top of the kidneys, according to the diagram there. So too much cortisol can cause weight gain, but it's usually weight gain around the trunk of the body. So you may see somebody with quite a big rounded body but very skinny arms and legs. A fatty lump between the shoulders, so it's usually at the back of the neck, and it just kind of looks a little bit like the goiter that we saw earlier on the neck, but instead of it being on the neck, it's kind of at the back of the head. Excessive hair growth, muscle weakness, blurry vision, decreased fertility and sex drive, tiredness, and then easy bruising and purple stretch marks that just appear spontaneously. The most common treatment for this is surgery to remove the tumour from the kidney, and that usually rectifies it. So they don't, people with Cushing's syndrome don't always need to have medication as well, because a lot of the time having the surgery will solve the problem. Okay. They will, however, once they've been diagnosed with Cushing's syndrome, even after they have surgery, they would need to be checked regularly, because there is a risk that the tumour can grow back. And then you have acromegaly, which is also known as gigantism. So I'm probably showing my age here, but if you remember the wrestler Andre the Giant, do you remember Andre the Giant? So Andre the Giant had acromegaly. So this usually occurs when the body makes too much growth hormone, and it can result in unusual growth of bones, organs, and other tissues around the body. So it can cause swollen hands and feet, growth of facial features, bone changes such as a protruding drool, so that gentleman there, thick dry skin, sweating and body odour, and a quite deep voice. So acromegaly is more common in males, biological males, than it is in females, but females do have that as well. And a lot of the time with acromegaly, females that have acromegaly do also have deep voices as well. So it sometimes can be treated, so depending on whether or not it's caused by a tumour, it can be treated with surgery. Sometimes it can be treated with medication if it is caught early enough. And also radiation therapy to reduce a tumour, and if the tumour is causing the condition, is also a possibility. Okay. But it has to be if it was diagnosed early enough, because it does get to a point, especially if the person has gone past puberty, where it's not really treatable anymore, so it just becomes about symptom management after that.
Just a question.
Yeah.
Is it hereditary?
It can be, but it's one of those things where it can also just be an anomaly in a family. So you may have a family where there's no history of acromegaly, and then you'll just have one person who will have it. You may have parents that one has it, one doesn't. In some, it's a recessive gene, so it can just pop up anywhere, or it can just pop up spontaneously. So another one that I think a lot of people would have heard of now, because there's a lot more publicity about it, so PCOS, which is polycystic ovarian syndrome. So this occurs when there is an imbalance of reproductive hormones, and this can cause irregular menstrual cycles, again excessive hair, acne, so really bad acne as well, and it can be all over the body. It can also cause thinning hair, so excessive hair on the body but thinning hair on the head, which seems a bit unfair. But it can also cause a lot of weight gain, and it can mean that there is difficulty in losing that weight. So you will find a lot of people with PCOS will say that they've been on every diet known to man and they can never lose weight. It can also cause darkening of the skin, so in somebody with pale skin, it's not an even darkening of the skin. They might have darker patches all over their skin in certain parts, and it can happen also when you have people that have darker skin like myself. It can cause really much darker, so it would look like black patches on brown skin and like dark brown patches on paler skin. And then you can also develop skin tags, and these skin tags can develop anywhere at all, and they can sometimes be mistaken for warts, and they get treated as warts, but then because they're not warts, they're skin tags, they get taken off and they can sometimes grow back. Okay, so they need to be treated properly. So PCOS is normally treated with hormonal, usually birth control pills, anti-androgen medications, or metformin. So metformin is also used sometimes in the treatment of type 2 diabetes as well. And sometimes people with, women with type 2 diabetes can also have PCOS, so they can have 2 endocrine disorders in one.
Does that get worse as you get older, do you think?
It can be progressively degenerative, yes, and because as you get older, obviously women go through menopause as they get older, and when you're going through menopause, it can sometimes actually help PCOS, because PCOS is where you have too many hormones. A lot of the time it's too many female hormones, and when you're going through menopause you have a reduction in those hormones, so just naturally going through menopause can actually help your PCOS, but it also depends on what causes it in the first place. It's a hormone imbalance, so until you've actually been tested for it and they find out if you have too much of the hormone or too little of the hormone, is how they decide how they're going to treat it. And then you also have precocious puberty. So this is an anomaly where puberty can occur in most cases around the age of 8, but it can actually happen earlier. So one of the earliest recorded cases is in a 5-year-old, and this was in the 1930s, I believe, and how they knew that she had this precocious puberty, her parents had kept it hidden, but unfortunately she was the victim of sexual abuse by somebody within the family, and she got pregnant at the age of 5, and that was how they knew that she had this precocious puberty. In a lot of the time it happens more in girls than in boys, but it does happen in both sexes. Emotions and behaviour will usually change, so the same kind of emotions and behaviour that you would get with regular puberty, just that it would happen a lot earlier. So all the other things will happen as well, so change in the body's development, they will grow hair, the girls will start to grow boobs, things like that. So everything that is associated with normal puberty, but usually happens between the ages of about 5 and 8. So once it is noticed and it is diagnosed, it can be treated with hormone injections. So the hormone injections are basically given to slow that puberty down, and then when they get to the correct age of puberty, then they'll usually stop the hormone injections, and then they'll just carry on and develop as normal.
Is that hereditary?
Again, it can just happen. So
So normally they sort of link your period times with, when did mum
when
start?
did your mum start?
Or when did mum have the menopause and so on?
No, with precocious puberty, again, it's just one of those things that is an anomaly, so it can just happen. So even if you had a mum that had precocious puberty and that developed quite early, it doesn't necessarily mean that you're going to. It's just no way of knowing, basically.
And would that affect their fertility later on?
It can affect their fertility later on if it's not caught early enough, or if it's not brought to medical attention early enough. So as we know, a lot of the time people are reluctant to go to the doctor, or they're scared to go to the doctor, they don't know what's going on. But nowadays it's flagged a lot sooner, because as soon as parents see any kind of hair where there shouldn't be at a young age, run them straight to the GP. So because it's being diagnosed a lot earlier now, that tends not to happen too much. Okay, and then you have multiple endocrine neoplasia. So this is a very rare genetic condition, and this is passed down through families, and it can cause tumours leading to the overproduction of hormone. So this usually causes tumours on the pituitary gland, parathyroid or pancreas, and the tumours are usually benign, but they can sometimes be cancerous. They can just develop spontaneously. With this, the chances are, if you do have a parent or a grandparent that had this, you can develop it. It is absolutely passed down through families. There is no way of knowing who's going to develop it. It can be male or female, but it's mostly men or males that develop this. Okay, and then hypopituitarism. Practice this a few times. So this occurs when the pituitary gland releases little or no hormones, and this condition tends to happen more in women, and it will mean that they won't get their periods. So it means tiredness and low energy, muscle weakness, headaches, constipation, extreme sensitivity to cold, and like we said, problems with menstruation. In males, it can cause impotence, and there can be problems in both sexes with fertility. So other symptoms, depending on which specific hormones are deficient. So it depends. Some people with this can also develop things like diabetes as well. So it can affect multiple parts of the endocrine system. So diagnosis and testing. So endocrine disorders have such a wide range of symptoms that can be mistaken for other things, and many of these symptoms can overlap with those of other conditions as well. So you may get the endocrine disorders as a secondary issue to other disorders as well, and this can make endocrine disorders really difficult to diagnose. So there are specific blood tests, urine tests, scans, images, genetic testing, hormone testing. There's quite a lot of a battery of tests that needs to be done to not only determine if it is an endocrine disorder, but to determine what endocrine disorder it is. And then treatment for the common endocrine disorders, there are three main treatments. So depending on the condition and the severity of the condition, hormone therapy is usually the first treatment option, basically because it's largely non-invasive. It can involve tablets or injections or a combination of both. And in some cases it can also involve dietary changes as well. This treatment needs to be right for the person who's having it, and it can include personalised treatments as well. Medication, so medication will be prescribed depending on what it is to help the body balance out the hormone imbalance, so to speak, and usually it will help to give them relief from any kind of side effects that they may be having because of the disorder. And then as a final resort, especially when tumours are involved, surgery. So the procedure may be needed usually if cancer is suspected, because there is no way of telling whether or not any tumour that develops is cancer or not. They do have to do a biopsy if a tumour is seen. If it's determined that it's not cancer, then they will try a non-invasive approach to shrinking the tumour. But if it is cancer, then obviously surgery will be necessary to get that out. And usually they take a multidisciplinary team approach to making sure that a person gets the correct surgery. Okay, so in summary, endocrine disorders are a collection of conditions resulting from problems with one or more parts of the endocrine system. And this is a complex system that produces and distributes hormones throughout the body for different reasons. These disorders occur when the endocrine system produces too much or too little of a hormone, or more than one hormone, or if the body does not respond in the correct way to a hormone. Endocrine disorders can be very challenging to identify because they may just seem like your normal behaviour, your normal body. So this is why a lot of the time people live with undiagnosed endocrine disorders. And it's really important to, if you do find that you do have more than one of these symptoms, to make sure that you speak to a doctor, get some medical advice, especially lifelong medication. So we already mentioned diabetes, type 1 diabetes especially, is usually a lifelong treatment plan. Okay, so we have a list of references and further reading there for you guys, and that is contained in your handout. Okay, and any questions?
I do. So with the endocrine system, is it, I know they're all scattered across the body, but do they kind of talk to each other?
They are supposed to talk to each other. So they're supposed to release different hormones for different things at different times. So if there's any breakdown in communication, especially between whatever part of the endocrine system in the body, that's where you're going to have a disorder come in.
So for example, like diabetes, it's looked at as potentially being hereditary.
Yes.
And thyroidism, potentially hereditary.
Yeah.
Is it likely that if, for instance, my mum has a thyroid problem and I have polycystic ovary issue, is that because, do you think there's that hereditariness? I know polycystic ovaries can be hereditary, I know, but they kind of talk
it's
under
kind
the
of,
same
yeah, you
umbrella.
think it might be linked because they're both under the endocrine system, but no. So usually if it is a genetic cause for your endocrine disorder, you would have the same endocrine disorder. So if it is a genetic cause of your diabetes and you are going to develop diabetes at some point, then it would follow that you, so it wouldn't be, I have a problem with this part of my endocrine system and my child has a problem with this part. It's usually luck. The same thing. Yeah, it's usually just luck, unfortunately.
I just wondered if they were all kind of semi-connected under the same umbrella.
I can see where you're coming from because it is all under one system, but they because they release different hormones that do different things.
Yeah.
If it is a genetic cause, then it will be the same thing. So if your mum has it, then you would have the same thing if it's a genetic cause. Yeah. Okay, are we all
Sounds like
good?
it's a cool thing getting old when it comes to the endocrine system. Is that the other umbrella is the menopause?
Yes, indeed. Okay, thank you very much. Okay, well done. Thank you.